Hello, and welcome to another Dental Watch one-on-one exclusive interview with top cosmetic and oral dentistry surgeons in the U.S. today. In this exclusive interview, we're going to discover if there is a difference when it comes to dental implants and who is a good candidate for this type of procedure. Doctor, let's get started with our number one consumer concern, cost. What are some of the pitfalls people fall into after going with the best advertised price versus having their implant work done by an experienced specialist?
Well, I really have no problem with someone who is looking for, quote, the best deal, as long as they're going to an experienced and reputable doctor who knows what they're doing. Very often, the best deal does not necessarily equate with someone with the most experience. So you don't want to be involved with a situation where you're looking at short-term success but long-term failure. And in any surgical procedure, my suggestion would be to always get a second and or a third opinion, because this is a relationship between the patient and the doctor. You have to feel secure with what you're doing. And if you're going to be spending a little bit of money or you're going to be spending a lot of money, you have to make sure that you have value, for that. So it's not so much, in my experience, that patients are looking for the best deal. But really what they're trying to obtain is the best value. And this is your health. And if you're willing to trade your health and long-term success for saving a few dollars, then you have to accept the responsibility for when those things do not go correct or go the right way.
That's great advice, Doctor. We actually have a testimonial from a dentist who was involved with a patient that went for cost versus experience. Let's see what he had to say.
This is a case that has taken 3 years from its inception to its completion. The patient is a woman in her mid-40s, early 40s, who went to see a dentist who recommended that all of her teeth be extracted and be replaced by implant-supported crowns and bridges. Unfortunately, there was an incomplete diagnosis and treatment plan made. The patient wound up with huge spaces that trapped food whenever she ate. She had pain, she had infection, she had implants placed partially on bone, but many of them were outside of bone. When the patient was referred to Dr. Smiler, I was present for all of the surgical procedures, of which I believe there were 5 or 6 general anesthesia surgeries in the office. The patient left the office with a Band-Aid on her hip, and if the Band-Aid wasn't there, she wouldn't have known she even had stem cells contributed to the surgical site from her own bone. The procedure was an office procedure because of the work that Dr. Smiler has done in bone augmentation. Otherwise, this would have been multiple visits to the hospital for these procedures. But under general anesthesia and his current techniques, he was able to do this in the office. The case looks excellent now at its completion, 3 years after its beginning. I have had opportunity to refer both friends and relatives out for implant placement. I have consistently referred them to Dr. Smiler, and I do it based on his capabilities, his knowledge, his understanding, his years of experience, the thousands of implants that he's placed, but more importantly than anything else is his approach to the patient, to do what is right, to get the very best possible results for the patient. That requires skill, it requires knowledge, it requires understanding of what it is that you're doing and what you want to accomplish. And as I've seen him teach others, so I see him apply these same principles to the patients in his practice.
Now, that was a very impressive, heartfelt story. Now, what about the consumer that has been told that they are not a good candidate for dental implants? From your experience, can you share with us who would be a good candidate for this kind of procedure?
There are a group of patients that are not candidates for dental implants, and that probably has to do with their medical condition, not their age. patients who are in chemotherapy, patients that have other immunologic conditions may or may not be a good candidate. But we have patients that come in with diabetes. They are a relative risk, not an absolute risk. If you have a diabetic patient who is diet controlled or medication controlled, yes, we do work. If we have someone who is not controlled, no, that's not a good candidate. Someone who smokes 4 or 5 packs of cigarettes a day, not a good candidate. Someone who smokes a little bit is a good candidate. One of my oldest patients that I've done was over 90 years old for a bilateral sinus lift and implants. And the reason we did that is because when he was scuba diving, he couldn't keep his mouthpiece in. And we had to cancel the operation once because he fell off the horse playing polo. So age is not the problem. It's really what your motivation is in order to do the work.
With that known, we actually interviewed one of your patients that was told they were not a good candidate. Let's go ahead and hear her experience.
Yeah, I went to my dentist, Dr. Baume. Because he does implant too. He said he looked at the bone and he said it looked too impossible. He could not do it before. Like I had no bone at up here, like. And then finally he said, okay, there's one dentist, like he's really good. He has a lot of experience. And he told me it's Dr. Smiler. It was Dr. Smiler. So then, okay, I went to see Dr. Smiler and look at, my bone and everything. But he said, and confident in him, he said he can do it. I mean, and when I heard that, I was so relieved. I like, oh, this my dream come true. Finally I found the right doctor. I mean, he said he can do it, and he did everything just like I would wanted him to do, and it just came out great. And so happy, I'm so thrilled that he did it. He made it possible for me to have implants and to have teeth in there. I'm just so happy, that he made it possible for me.
So the moral to this story is always get a second opinion from a qualified specialist to see if you're a good candidate for dental implants. And lastly, doctor, can you share with us what qualifications should someone look for when seeking an experienced oral dentist?
Well, it's a very interesting question, because you take someone like me who've been teaching implants since probably the mid-'80s and have taught thousands of doctors how to do this. Implant dentistry, placing or drilling a hole in the bone and putting an implant in, that's easy. But learning how, what, when, which, and why, that's the difficult part. And that comes with experience. So the question that you have is, how do you evaluate that doctor? And you want to know, how much experience do they have? Are they immediately out of a residency program? I don't know. How much experience do they have placing on implants? Are there patients in their office that run through their office that perhaps they would not mind if they called the patient to see how it went? Before you enter into any type of treatment, whether it's medical or dental, you have to have that kind of evaluation of the doctor on the other end, because this is your oral health that we're talking about.
Thank you, doctor, for your input here on Dental Watch One-on-One. And we hope that this exclusive interview has helped you, the viewer, make the right decision when choosing an experienced implant dentist for your dental well-being.